If you've been hearing that gabapentin prescriptions are surging, you're not imagining it. Gabapentin is one of those meds that quietly shows up everywhere for pain, nerves, sleep, anxiety, even though the official label is much narrower. So let's translate what it actually is, what it's approved for, and what to watch for. Quick safety note before we start. This is educational only. I'm not telling you what to take, how to take it, or whether you should start, stop, or change any medication. For personal decisions, talk with your doctor, pharmacist, or another qualified clinician. Gabapentin was developed by Park Davis, a division of Warner Lambert, and the first brand most people heard was Neurontin. In the US, it was originally approved by the FDA in December 1993 as an add-on medicine for certain seizure disorders. Later, gabapentin also gained approval for postherpetic neuralgia, which is nerve pain that can linger after shingles. Gabapentin is considered an anticonvulsant, meaning it started life as a seizure medication. You'll also hear it called a gabapentinoid because it's in the same broader family as pregabalin, also known as Lyrica. One confusing thing right away, gabapentin sounds like it's related to GABA, the calming brain chemical. It was designed to resemble GABA, but it doesn't work the way people assume from the name. It's not basically GABA in a pill. Think of certain nerve symptoms like burning, shooting pain, or electric zaps as nerves firing too easily or too loudly. Gabapentin works by binding to a specific part of calcium channels on nerve cells, something called the alpha-2 delta subunit. Human translation, it can calm down the nerve signaling that helps drive certain types of nerve pain and seizure activity. It's not a classic painkiller like ibuprofen, and it's not an opioid. It's more like a volume knob on nerve excitement. That's also why it can make people feel drowsy or foggy. If you turn down nerve signaling broadly, the brain sometimes feels it. What it's used for, and what's actually approved. On-label, meaning FDA-approved uses for gabapentin itself include postherpetic neuralgia in adults, that's shingles-related nerve pain, adjunctive therapy for partial onset seizures in adults and in kids age 3 and older. Now here's the part that explains why it's everywhere. Gabapentin is also widely prescribed off-label. Off-label does not automatically mean wrong. It means the use is outside the exact FDA-approved wording, and the evidence can vary a lot by condition. Common off-label areas people may hear about include other kinds of neuropathic pain, like diabetic nerve pain, and sometimes things like anxiety, sleep, or restless legs. I'm not endorsing any of that here. I'm just telling you why it trends in real life even when the official label looks narrow. One more quick clarity thing on brand names. People say gabapentin and lump everything together, but the product matters. Neurontin is the classic immediate-release gabapentin brand. Gralis is an extended-release gabapentin product approved for postherpetic neuralgia, and it's not considered interchangeable with other gabapentin products because it behaves differently in the body. Horizon is gabapentin enacarbil, which is a prodrug, basically a modified form that turns into gabapentin in the body. It has its own label and approvals, including restless leg syndrome and postherpetic neuralgia. So if you ever hear gabapentin is gabapentin, it's true in a general way, but it's not always true in a pharmacy, paperwork, or insurance way. Always worth confirming which exact product name is being discussed. What people commonly feel. Let's split this into two buckets: common and annoying, and less common but important. Common and annoying. The big two are dizziness and sleepiness. A lot of people describe it as feeling off balance, a little drunk, or just slower. Some people feel brain fog, like it takes more effort to focus or find words. Fatigue can happen, so can swelling in the legs or feet, which surprises people because it feels unrelated, but it's common enough to be on the radar. Weight gain can happen for some people over time, partly because of fluid retention or appetite changes, and sometimes because people move less when they feel drowsy. Coordination can be affected, and that's why driving or anything that requires fast reactions is a real go slow area until you know how your body responds. Less common but important. Mood and behavior changes matter here. Like other anti-epileptic drugs, gabapentin carries a warning about suicidal thoughts or behavior. That does not mean it causes that in everyone or even most people, but it does mean any new or worsening depression, unusual mood shifts, agitation, or thoughts of self-harm should be taken seriously and brought to a clinician quickly. There are also rare but serious allergic-type reactions, including DRESS, which is a severe drug reaction that can involve fever, rash, swollen lymph nodes, and organ involvement. You don't need to memorize the acronym. The practical point is that a widespread rash plus feeling very sick is not something to wait out. Gabapentin can also cause withdrawal symptoms in some people if it's stopped suddenly, and in people using it for seizure control, abrupt changes can be risky. That's a clinician conversation, not a self-experiment. Red flags and serious warnings. If any of these show up, contacting a clinician urgently is the right move, and if it feels severe, seek urgent medical care. Here are the big ones. Trouble breathing, especially if gabapentin is combined with other sedating meds. severe sleepiness that feels unsafe, confusion, or repeated falls, new or worsening depression, agitation, or suicidal thoughts, a serious rash, especially with fever or facial swelling, swelling of the face, lips, tongue, or throat, or trouble breathing, which can signal anaphylaxis or angioedema. There's one warning that's become a bigger deal in the last few years, and it's a big reason gabapentin is in the news. The FDA has warned about serious breathing problems with gabapentin, especially in people who have respiratory risk factors, and especially when it's combined with opioids or other medicines that depress the central nervous system. Older adults and people with lung disease like COPD are higher risk. That's not meant to scare you. It's meant to explain why gabapentin plus something else is where danger can show up. Things not to mix and what to double check. This is the section that saves people the most trouble. Alcohol. Alcohol can stack the dizziness and sedation. Even if you tolerate one or the other fine, the combo can hit harder than expected. If alcohol is part of your routine, it's worth a quick double check with a clinician so you're not guessing. Other meds that stack sedation and breathing risk. This is the big category. Opioid pain medicines are a major one. The combination can increase the risk of respiratory depression, meaning slowed or ineffective breathing. Other central nervous system depressants can also stack, like benzodiazepines, sleep medications, muscle relaxers, and some sedating antihistamines. Even certain nausea meds can add to the too sleepy, too slow effect. The theme is simple. If it makes you drowsy, it can stack with gabapentin. OTC meds people forget about. A lot of people accidentally create a sedation cocktail with over-the-counter products, sleep aids that contain diphenhydramine, some allergy meds, some cold medicines, and even motion sickness meds can push sedation and confusion, especially in older adults. Also, antacids can interfere with gabapentin absorption. This one doesn't usually create a dangerous reaction, but it can change how well the medication works, which can create confusion like, is it failing or is something blocking it? It's a good pharmacist question. Supplements and other substances. This one is more about unpredictability than a single famous do not mix ingredient. Cannabis products can stack sedation and coordination problems for some people. Kratom and other sedating substances can increase the overall risk picture, and anything that affects alertness or breathing is worth discussing, especially if there's also an opioid or sleep medication in the mix. Procedures and medical conditions worth flagging. Gabapentin is largely cleared by the kidneys, so kidney function matters. Older adults are more likely to have reduced kidney function, which can increase side effects even at typical doses. That's one reason clinicians often treat gabapentin differently in seniors. If someone has sleep apnea or COPD, that also matters because those are breathing risk factors. Again, not a guaranteed problem, but it changes the risk math. Why it's surging in the first place. This is the context that makes the trend make sense. Gabapentin prescribing has steadily increased in the U.S. In 2019, tens of millions of prescriptions were dispensed, making it one of the most commonly prescribed drugs nationally. A lot of that growth is tied to off-label use for pain and other symptoms, partly because clinicians have been trying to reduce opioid exposure when possible. But at the same time, public health agencies have pointed out that gabapentin shows up more often in misuse and overdose situations when it's combined with other depressants, especially opioids. So it's trending for the exact reason people feel conflicted about it. It can be useful in the right scenario, but it's not a freebie med, especially when it's stacked with other sedating drugs. Quick takeaway. Gabapentin is an anticonvulsant that's FDA approved for postherpetic neuralgia in adults and as add-on therapy for partial onset seizures in adults and kids age 3 and up. It works by calming certain nerve signals through calcium channel subunits, which can help some nerve pain and seizure conditions, but it can also cause dizziness, sleepiness, and coordination problems. The biggest safety themes are sedation and fall risk, mood changes including suicidal thoughts, rare severe allergic reactions, and increased breathing risk when combined with opioids or other sedating medicines. The biggest interaction theme is stacking, especially stacking sedation. 3 questions to ask your doctor or pharmacist. Does gabapentin make sense for my exact diagnosis? And is this an on-label or off-label use? What other meds or OTC products I'm taking could stack sedation or increase breathing risk with gabapentin? What symptoms would make you want me to contact you urgently? That's MedLabel Translator. No hype, no panic, just the label translated into normal language.